Update: Coffee and Diabetes by www.buyorganiccoffee.org. We have known for several years that coffee drinkers tend to have a lower risk of developing type 2 diabetes. The Mayo Clinic website notes that the risk of developing diabetes is reduced by drinking coffee, but that drinking coffee does not actually cure you if you have diabetes. The protective effect of drinking coffee increases up to about 5 to 6 cups a day, and it's the same for caffeinated and non-caffeinated coffee. Adding cream and sugar may tend to raise a person's blood sugar momentarily, but do not reverse the protective effect of not getting type 2 diabetes. Drinking coffee if you have diabetes. Polyphenols are the molecules in coffee with antioxidant properties. They are what helps prevent type 2 diabetes, heart disease, cancers, and other diseases. In addition, the magnesium and chromium present in trace amounts in coffee also reduce type 2 diabetes risk. The risk reduction ranges from about 11% for 1 cup a day up to 17% for those who consume more than a cup a day. There is some evidence that in diabetics, caffeine further reduces insulin sensitivity. Thus, some experts suggest drinking decaf coffee. The best choice for diabetics who drink coffee is to use skim milk instead of cream, Splenda instead of sugar, or just plain black coffee. Coffee can lower or raise blood sugar in diabetics. While the research is pretty clear that coffee drinkers are less likely to develop diabetes, it is not clear in regard to whether in a specific individual with diabetes if coffee will lower or raise their blood sugar. The bottom line that we can discern from looking at research on this subject is that there are two different effects of coffee. Routinely, drinking coffee has a strong tendency to reduce whatever factors drive a person to get type 2 diabetes, and very likely continue to have this protective effect in diabetics. In other words, a type 2 diabetic will probably not get a worse case of their disease if they continue to drink coffee. The other effect is that by drinking coffee, a type 2 diabetic may tend to temporarily either raise or lower their sugar. Should a type 2 diabetic quit drinking coffee? If you are a diabetic, you should be checking your blood sugar. As such, you will be able to see if your morning cup of black coffee raises or lowers your blood sugar. This is probably the most practical approach. For diabetics who already have complications such as retinal or kidney disease, the wise approach is to ask your doctor what to do and strictly follow their advice. Because there is some evidence that diabetics who drink coffee experience a drop in their blood sugar, this is beneficial, and as we noted, there appears to be a long-term benefit of coffee drinking, even in those who are now diagnosed as having type 2 diabetes. Medium roasted coffee for maximum phenol content. Since it is the polyphenols that provide the most protection against developing type 2 diabetes, which coffee gives you that benefit? Medium roasted coffee provides the greatest phenol levels, and the best coffees are Arabicas like coffee from Colombia. For more insights and useful information about organic coffee, visit www.buyorganiccoffee.org.